Greetings from Washington, D.C. This is Peter Thomas with the National Association for the Advancement of Orthotics and Prosthetics, NAAOP. Two main issues I want to bring to your attention this month. The first involves the VA, the second involves the prior authorization regulation in a proposed form that was issued by the Centers for Medicare and Medicaid Services. But first, the VA. As many of you probably know just by reading the newspaper, Secretary of the VA, Eric Shinseki, resigned last week amid multiple allegations of the VA simply not serving veterans in appropriate ways. This included long waiting lines and lists for VA services, particularly in Phoenix, but also in 26 other facilities that are being investigated around the country, as well as we're learning about significant swings in the quality of care that are received by veterans in different cities throughout the United States. This also implicates the Legionnaire's disease issue that occurred up in Pennsylvania, as well as other VA missteps. This was a trying time for the Veterans Administration, and many veteran service organizations had to decide whether to call for the Secretary's resignation or not. The American Legion actually did. Many of the others withheld judgment until the issuance of an Inspector General's report that was quite damning of the VA. Many of us are a bit surprised that the public knew so little about the failures of the VA to meet the needs of veterans, because we see on the front lines every day how amputees and others with disabilities oftentimes are not served well by the VA. The VA does have a very significant 170 hospital system that has some exemplary instances and illustrations of care, and yet this consistency is simply not the case across the country. And we've seen that as Exhibit A with respect to orthotic and prosthetic care. That's why we have been fighting hard to try to get the Injured and Amputee Veterans Bill of Rights, H.R. 3408, through the Congress. We think that this instance where the country is focused on the Veterans Administration trying to improve the VA offers us a new opportunity to try to move that legislation forward, and we encourage all of our members to push forward with trying to get support for that bill. Second, with respect to prior authorization, a proposed rule came out. The comments are due at the end of July 28th. And both NAAOP and our alliance partners are working hard to address the issues that were raised in the proposed rule. The proposed rule ultimately would impose prior authorization on a predetermined list of services in the DMEPOS area. If a particular item or service makes that master list from which those devices exposed to prior authorization would come, then they would be subject to prior authorization, and patients who come to, for instance, a prosthetist for prosthetic care, if one of those items or services on the list is implicated by prior authorization, they would need to go through that process and secure all documentation prior to going forward with the production or the design fabrication of a limb. Some prosthetists believe this is a better alternative to the pay and chase model that we're in now, where a 2-year delay in the appeals process basically renders the prosthetist without any options and leaves them holding the bag. Others strongly disagree, and I would suggest that the national organizations are still formulating their opinions. AOPA has come out with its opinion. The NAAOP is considering its position on this issue. But by and large, we're moving towards a position that prior authorization really is not a good policy. It's not in the interest of patients. And we would really, in exchange for any kind of a prior authorization model, we would very much like to see some changes to the way that audits are performed on O&P claims. Again, we're still developing these policies, and we'll let you know as soon as we have more detail on the outcome. But we encourage O&P providers to examine this proposed rule. You can find this on our website, www.naaop.org, and we look forward to speaking with you during the next webcast. Thank you.